So welcome to our roundtable presenters. Before we get into their stories, I'm going to take just a couple of minutes to give a little picture of what we're seeing going on from a trend perspective with redesign. Certainly 2020 was, well, certainly the most unusual year I've experienced in healthcare during my career. And I think that's probably true for most of us. And as we did our annual survey, the impacts of the pandemic appeared in a number of different ways, and in many ways that reflected on what's been going on from a redesign perspective. So one of the questions that we always ask is around budgets. We actually ask a whole bunch of questions around budgets, but in particular, I wanted to look at some questions we ask around how organizations expect their budgets to change in the coming year. We ask about the overall marketing budget, and we ask about the digital marketing budget. And perhaps no surprise, we're seeing a larger number of organizations than ever before indicating that their overall marketing budget is shrinking, right? The pandemic really took a toll on financials at healthcare organizations, and so they're seeing a cut there that's pretty big. More than 40% of respondents indicating a cut to their overall marketing budget. And again, this data was collected mid-2020, so that would be for budgets going on now. We've never seen numbers quite that large. We do see overall marketing budgets fluctuating a little bit more. We contrast that with what we're seeing with digital. And the digital story, there's some good and some bad in here. On the one hand, 21% of organizations indicated that their digital marketing budgets were going to decrease. Compare that to the 41%, that seems pretty good. On the other hand, in all of our past surveys, we've never seen more than a handful of organizations that have had cuts planned for their digital marketing budgets. And usually those are unusual situations. An organization has been undergoing a really major initiative, and they know they're not going to be investing at nearly the same level on an ongoing basis as they did for that year. So those were pretty isolated situations. And so while the numbers in terms of decreases from a digital marketing perspective are much smaller, they're, again, an order of magnitude larger than we've ever seen before as we've asked this question over the years. Now, we have the other side of the coin here as well. While 21% of organizations say that their digital marketing budget is going to decrease, nearly twice that number, 38, 39% said that that digital marketing budget is actually going to increase. So part of what we're seeing here is an acceleration of a trend that we've seen for a number of years, where we're seeing more of those budget dollars shifting from traditional marketing channels to digital channels. So even in many organizations where overall marketing budgets are staying the same or shrinking, the digital marketing budgets may be getting larger. We dug into this a little bit more this year as well, asking some questions specifically about the pandemic's impact on both digital marketing initiatives on the right and digital transformation initiatives on the left. And this really came out of conversations that we were having with a lot of healthcare organizations, and they sounded something like this. On one day, we would be told, you guys are healthcare experts, you're working with lots of healthcare organizations, therefore you know that we're all tightening the belt, we're all going to be investing less in the coming year than we have been traditionally. And the next day we would go into a conversation where someone would say, you guys are experts in healthcare, and so you know that we're shifting a lot of dollars to digital. We need the flexibility, we need the ability to turn things on and off as we open and close, et cetera, et cetera. And we're going to be really leveraging digital more than we ever have before. And those two messages seemed very much at odds with one another. And so we wanted to get a better picture of what was really going on out there beyond the anecdotal conversations that we were having. And the picture looks and feels a lot like the conversations we were having. Looking at the digital marketing initiative side of this, 41% of organizations saying, hey, we have pumped the brakes. We've canceled initiatives, we've delayed initiatives. We're just going to be more conservative right now. At the same time, though, we had 31% of organizations saying, you know what, this has lit a fire under us, and we are investing in digital at an accelerated pace. And then also we had some mixed items. So the other category in the upper left there, that was really organizations indicating a shift of priorities. We slowed some things down, we sped other things up, changing priority mix. The picture is similar when we look at digital transformation. So 35% of organizations saying, hey, we're pumping the brakes, 33% of organizations saying we're going faster, More uncertainty on the digital transformation side than on the digital marketing side, but again, a very mixed bag here in terms of how organizations are adapting. The takeaway here, for me anyway, has been that every organization, every healthcare organization, experienced the pandemic in a different way. It had a different impact on the organization, and they reacted to it and adapted to it in different ways as well. So whatever you did in your organization is only representative of what happened in your organization and isn't necessarily what happened at every other organization, including organizations you may compete with directly. So just because you slowed down or just because you sped up doesn't mean that other organizations that you benchmark against, that you compete against directly, they may not have been doing the same thing over the course of the past year. Another way that we saw the pandemic play in was in those website redesign plans. And again, we ask this question every year. Are you in the process of doing a redesign? Have you just finished a redesign? Are you in the planning stages of redesign? Or no, is that not in your immediate future? And typically we see, I don't know, a 4 or 5 year cycle on this, right? So 20 or 25% will have recently completed, 20 or 25% will be in the planning process, 20 or 25% will be in the redesign process right now, and then the remainder, 30 or 40%, whatever that works out to, are kind of outside that cycle for a year or two. This year, we see those three different segments looking very different, right? The redesign recently completed, and so these are mostly redesigns that were completed prior to the pandemic. About 1 in 5 organizations responding to the survey. When we look at organizations redesigning in the middle of 2020, more like 1 in 7, only 14%, a pretty significant downshift there. Now, just because they're not doing something in 2020, though, doesn't mean that the demand has gone away. It's just been put on the shelf for a year until people can put the time and attention and resources into that redesign. And so when we look at the planning stages, 30% of organizations were in the planning stages here. And again, this was in the middle of 2020 when we were doing the data collection here. So we are expecting to see a lot of redesign activity here in 2021, and anecdotally, we've started to see a lot of those organizations start moving. Now, when we look at who's doing the redesign, some of this, may make a lot of sense. It may be pretty intuitive. Organizations that are leading the way, and we break out our survey into organizations that are digital leaders and kind of keeping up, which we call average, and falling behind, which we call laggards. So the leaders tend not to be the ones redesigning, and often having recently completed a redesign is part of what makes them feel like leaders, or even organizations that are in the keeping up category. They've leveled up as a result of having done a redesign recently. The place where we see more redesign activity is in organizations that feel like they're behind, organizations where it's been longer and they feel like it's time to either keep up with where they are, or very often we hear that this is the catalyst that they expect to start a process of leveling up from a digital communications perspective. When we look at goals, we see some important shifts here as well. In the past, as we've looked at this category, we've had really clear delineation. Usually it's all the patient and consumer goals at the top, and then there's a step down. All the financial goals follow that, and there's a step down, and then all of the other audiences, physicians, employees, donors, folks like that. And so that's largely how this plays out still. The big shift that we saw this year is patient acquisition jumped to the top of the list, and jumped to the top of the list by a really big margin. The highest score that we've ever had before, or a typical score, what we had in 2019, for instance, was like in consumer engagement at a 1.22, right where it is this year. Patient acquisition, though, leapfrogged that, and again, by a pretty wide margin. Reminder again, we're collecting data in the middle of 2020. We'd had shutdowns in a lot of healthcare organizations. We'd had reopenings in a lot of healthcare organizations. And so filling schedules was highest priorities. And I think continues to be a really high priority for most healthcare organizations still right now. Now, when we look at leaders, more of their focus, more importance being placed on those consumer and patient goals. So yes, patient acquisition is very important, but it's right in the range with things like consumer awareness and consumer engagement. Interesting to me, though, when I look at the average group, that middle group, they have a lot of pressure on them around financial results. Yes, patient acquisition is number 1, but numbers 2, 3, and 4 are ROI, revenue, and profitability. And so they've got budgets that maybe are a little bit larger than the laggards, and so that gets them a little bit more scrutiny, maybe aren't quite at the place that some of the leaders are, where they seem to have gained some credibility and some trust, that they don't have to be quite as on the line for financial payback for the investments they're making in digital. A lot of pressure in that middle group around delivering on the dollars and being able to demonstrate that. Final thing from a trend perspective here, we also ask a bunch of questions about what website features are most important for digital marketing success. And I should say, because I've been throwing a lot of data out here, you can get all of this from our website. We've got a full report and it's available for free. Just go out to geometric.com. When we look at the importance of different website features, the top couple are things we'd expect, right? Provider directory, online bill payment. These are core capabilities and pretty consistent with what we've seen in previous years. The next three, though, are pretty new to be this high up on the list, right? Appointment scheduling for current and new patients and video visits. Certainly video visits was nowhere near the top of the list before 2020. These have become critically important for a lot of organizations out there. I'll also direct your attention to some items at the bottom of the list, things like AI chatbots and virtual assistants and mobile apps. They are, on the whole, across the board, pretty far down the list. However, when we look at the data behind those scores, these are love them or hate them items. Very few organizations scoring these things in the middle. Either this isn't something we're doing or not something we feel is important, or we're doing it and we're doing it because we see this as an opportunity to differentiate ourselves competitively in the marketplace. And so while they fall to the bottom of the list, that doesn't mean that there aren't organizations investing aggressively in these things because they see them as differentiators in their marketplace. All right, enough of the overall trend information. Now we get into the good stuff. We get to hear stories from our digital professionals who have gone through redesigns recently, talking about their experiences. And first off, we have Alex Cree from Fisher Titus in Norwalk, Ohio.
Thanks, Ben. Good afternoon, everyone. Fisher Titus is located in Norwalk, Ohio, and our health system services the 70,000 plus residents of Huron County. Our health system includes our medical center, skilled nursing facility, assisted living facility, a home health center, North Central EMS, and several physician practice locations. We're located directly in the middle of Toledo and Cleveland, so there's a lot of need to keep up with the competition those areas have to offer. Our goal, and we use our website to assist with this, is to let area residents know that they can get quality health care in their own community without the need to travel. So what triggered our redesign? A few things. The old site that we had was really hard to navigate. We got a lot of feedback from people that they couldn't find the information that they needed. It had a basic, outdated design that was more of a templated feel. And it sat with a company who didn't specialize in healthcare, but more sales leads. So some of the things they were suggesting for us just wasn't a good fit in the healthcare world. And our website had various modules versus one CMS. So our goals as we went through the redesign were really three things. The biggest one was to enhance our user experience. We really wanted to make sure that when someone comes to fishertitus.org, they were able to find the information that they needed quickly without having them bounce out and go somewhere else. We really wanted to create a more modern, fresh design and have that reflect the quality care that we're providing here. The old site just did not match that level of care. And again, make that information easier for people to find, which rolls right into that user experience. So this is our new site. We're very excited about it. It was built on the Vital Site CMS, and it launched at the end of March. It has a really great modern, fresh look. It has a great responsive design, so no matter what device you're on, the website will work great for people. So one thing we really liked about our redesign and working with Geometric is we were able to do cross promotion on our pages. So as you can see here, as an example, it's a pediatrics page, but you also have things like related locations, related providers, and related news. So it's really one-stop shopping for anyone who was looking for pediatric information. We can also put related events on there as well. And as you can see at the top, there's a schedule an appointment button where people can go right ahead and just schedule that online appointment. For us, this was a big deal. We didn't want people to have to click on several things to find the information that they needed. Another thing that was really exciting for us is event promotion. We can now upload and control our own calendar, whereas before we were not able to do that. We're able to add more description. We can add related events. So as you see here, we have our diabetes education program. So let's say someone's looking at this and they're like, oh, I can't make this date, but they click on related events. It will show them other dates that may work with their schedule. Events are a big driver for us. We're in a rural community, so a lot of times grassroots marketing and efforts work well for us. So being able to have a calendar that offers this functionality was huge. A phase 2 for us with our events and promotions is a payment module. So actually trialing that with our North Central EMS membership program, where people will be able to go on and sign up for that and pay online. So we're very, very excited about that. Another item that we were excited about was our blog. So we use our blog in many ways. It's housed on the website. It's also pushed to those related pages. So for example, this blog is about stress, which will show up on our behavioral health page with that cross promotion. We also run our blogs on social and link back to the website, as well as run it in our local news media. So it's really exciting to be able to enhance the blog in this manner. And then I can't say enough about VitalSite. This is the second redesign that I've done with Geometric, and the love I have for VitalSite is huge. It is so easy to use. It's one tool, whereas before our website had several different tools we had to use to make updates, and it just was not easy. VitalSite's great too, because you can also give others access to pages, and you can give them as much privilege to the page as you want. So for example, for us, we can give members of our foundation department access to their pages, and we can limit how many edits they can make. We can have it to where it has to be approved before those changes are pushed live. It's just a really, really great tool, and it's so easy to use. We have people on our team who hadn't used it before, and they picked it up right away. It's really a great tool. So as I said, our site launched at the very end of March, so we haven't even been live for a whole month yet. These are just some preliminary stats that we have, but anecdotally, I can share that people are coming up to us in the hallway and commenting on how great the site is, how easy it is to use, just the look and feel of it. So I'm really excited as the site gets older and older that these stats go up and just see how much people are enjoying the website. So tips for selling the need of a redesign. So if you are looking to do a redesign and you need to talk to your senior leaders or whoever to get approval, a few suggestions that I have. One would be anytime you get a negative comment about your current site, write that down. Take those negatives and then take them to your senior leaders or the powers that be and let them know what people are saying. That just helps build your case of all the negative experience that's going on and the need for a redesign. Also remind your stakeholders how the website is a part of your overall marketing plan. So a website is integral to a comprehensive marketing plan. It really should be that place where people could go find the information that they need. You're not going to get all of that information in a newspaper ad, a social post, a billboard. So it's really nice to have a website where people can go and find everything they need. And then also helps with better Google ratings. So I know a lot of times you'll hear from people, oh, we don't show up on Google, or I can't, when I Google, I can't find this. Having a well redesigned site with copy on it where you have opportunity to increase SEO will help with those Google ratings. And we're already seeing that with our redesign, even though it's not very old. And then some other tips that I have as far as like getting the redesign done is don't wait on content. I know for us, we kind of were like, oh, we'll go ahead, we'll get that done, and it sneaks up on you. So the biggest thing that I could say is probably make sure you start well in advance. If you are doing a redesign, when Geometric says, hey, you've got to have X amount of pages done per day, listen to them and do it. They're the experts. Also, make sure when you're going through that redesign process, you do include your stakeholders. I know for us, Geometric was provided a stakeholder survey that we were able to send out to those who we wanted their feedback. And it really came in handy when it was time to do the build. And that way we could include what those stakeholders were looking for. And then also create phases. Don't feel like you have to do everything at once. So for us, I mentioned earlier how a phase 2 is to include that payment model. So if you're able to like break it down into several phases, like phase 1 should be your must-haves. Phase 2 could be things that can wait, and then phase 3 are those nice to haves that maybe you could do 6 months to a year down the road. Thank you so much.
Thank you, Alex. Next up, we have Barry coming to us from East Tennessee Children's Hospital.
Thank you, Ben, and welcome everyone. Appreciate you taking the time for this. East Tennessee Children's Hospital is a 152-bed pediatric hospital located in the heart of Knoxville, Tennessee, in the Great Smoky Mountains foothills. We serve the entire East Tennessee region from Johnson City at the eastern tip of Tennessee to the Cumberland Plateau in Middle Tennessee, and from the Kentucky border to the north and Georgia to the south. We care for seriously ill children in a unique pediatric environment, and we offer many pediatric subspecialist services. Children's Hospital works with the University of Tennessee Medical Center, the area's level 1 trauma center, to ensure that injured children receive trauma care at the institution most appropriate for the child's needs. We operate 14 pediatric primary care offices throughout the region, as well as 3 pediatric urgent care centers, an outpatient pediatric rehab center, outpatient surgery centers, and pediatric home health units. Plans are underway to open our 4th pediatric urgent care center in the fall. So while our main hospital campus is in Knoxville, we operate several campuses around the region, and the fluidity of these offerings made it a challenge to keep up with all of our locations on the website and to present a unified health system online. When I started in the marketing department at Children's Hospital about 3 years ago, I was the first staff member to hold my position in several years. The hospital's original website was custom designed, but extremely specialized, and the designer was pretty much the only one that really knew how to edit it. When that person left, a CMS development company was commissioned to build a new site, but lack of experience with web design on the staff, plus some poor communication all around, resulted in a website that was functionally frustrating, offered less than optimal support, and ultimately didn't fulfill the goals of the organization. So a big reason for this disconnect was that the most recent CMS developer wasn't healthcare specific. They showed competence in general sense of web design, but didn't possess an expected level of healthcare knowledge and a digital healthcare communication background. In addition, a lot of the administrators and especially physicians weren't happy with how our Find a Doctor worked and was presented. And as we all know, when docs talk, people listen. And this was a big driver in the decision to hire myself, a full-time web specialist. And when I took on that role, assessing the current site and moving to a new vendor was one of my first and biggest priorities. So selecting Geometric was a no-brainer for me from the beginning. They had been in the mix of healthcare CMS companies' decisions in several of my previous positions. And so when it came time to select a website CMS, I was already quite familiar with their business process, the quality and the experience in the field of digital healthcare communication. When we began working with Geometric, we specified several goals for a website redesign. First, we wanted to expand our reach beyond Knoxville and Knox County and the surrounding counties. The entire East Tennessee region encompasses 36 out of Tennessee's 95 counties and a population of almost 2.5 million people. We have a dedication and responsibility to reach every child in our region, and we want to make sure we're thought of as East Tennessee's own children's hospital. Second, we wanted to inspire confidence in all the parents and supporters in our area and our organization's level of expertise, and our commitment to quality healthcare and our superior staff by presenting ourselves in the most favorable manner online we can. We needed to increase our visibility and the quality of information about our programs and departments and specialties. And a big goal was to improve the general user experience and make it more pleasing to all of our audience. Better navigation, easier to find doctors, services, and locations, and of course, responsive design to be used on mobile devices. They were all important upgrades that we needed to have made. The old site was not very responsive and not mobile friendly. And finally, we needed a more robust provider directory to let our doctors shine. And then we needed to be able to present to our administration and stakeholders, as well as ourselves, a unified digital strategy and direction. Continuing to integrate all the areas of our marketing strategy together is an ongoing goal. So here's our new site, and it's built on Vital Site CMS. It's responsive, it's fast loading, and it's been active for a little more than a year now. We actually went live last February of 2020. In fact, less than a month after our launch, we all went into lockdown. So it's been a very interesting first year to evaluate how well the website has performed. I'm going to show you a few highlights, and this is one of the things that we're most proud of. We feel like as a children's hospital, we have a responsibility to treat the mind and the soul of the child, as well as to heal their body. For a person just starting out in life and very apt to find hospitals a big and scary place, our leaders over the years have incorporated a large number of sponsored art projects from the community to be displayed throughout our facilities, collectively referred to as the Art of Healing Project. It's created to appeal to a child's perspective. These art projects are colorful, whimsical, and hopefully evoke a smile or a laugh from all that experience them. So from the very beginning, we wanted to incorporate these unique signature art elements into our site design, and we were fortunate that not only does Kinetic employ talented designers, they have staff who have great artistic talent as well. They were able to create these design elements using photographs of various select pieces and use them as device design elements. On the right above, you can see two of these art pieces that are displayed inside our NICU. The bottom is a balloon representation called Afloat, and you can see how it evolved from a photo to a sketch to a realized graphic design. The other one on the top is one of my personal favorites. It's a floating paper castle called Just Imagine. And you can see how it evolved into a call to action box. Here's another example, a wood and steel sculpture entitled Bluebird Atrium. It's also in our NICU, and it's been reimagined to accompany a section of text on the homepage that introduces users to the hospital and invites them to learn a little more about us. And I think this was actually our proof of concept when the first redesign or design example was presented to us. They provided this particular sketch. The Whimsy, I call it the Whimsy Project. It was spearheaded by the talented Bree Lovelace at Kinetic, and I can't say enough about her artistic talent, being able to take these photos and transfer them to digital elements. And we have another one called the Eureka Kinetic Machine. It's a gift from the Discovery Channel. We have a partnership with them since they acquired the Knoxville-based Scripps Networks, which is the home of HGTV and Food Network, among others. And this contraption is actually located in our outer lobby. And when it's activated, it moves a number of little balls around and is extremely enjoyable to watch. Unfortunately, it's also quite loud, and on occasion, not very accurate in its ball tossing. But when you see it in action, you are mesmerized. And anyone who enters the hospital through the main lobby passes by, so it's very recognizable. Okay, as I mentioned above, we are in a period of expansion across our area, going from 2 to 3 campuses last year and soon to 4 main health center campuses. It's very important that we make it very convenient for users to find all of our locations. From our urgent care centers to the 14 pediatric offices we own and operate, we worked hard to get these posted correctly, especially since several of them serve underserved areas. And we want to make sure parents don't have to drive an hour to get a great pediatrician for their children. The old Find a Doctor functionality was vital to be redesigned, and our new physicians directory is now meeting all of our needs. The website imported entries from our credentialing directory, and we work with their office to make sure all the provider listings are accurate and up to date. And we have several search criteria to help users pinpoint their searches, and the resulting profile page includes not only an interactive map to the doctor's location and all their specific information, it all gives us a space, also gives us some space to list instances where they have appeared in local media discussing pediatric health topics of interest to the community. We also can post videos of them that we have taken of them talking about their experiences and particular health topics. It's very interactive, it's intuitive, and it's easy to customize. And our content, we work carefully with each department in the hospital, and they each reviewed their own pages for accuracy and completeness. And this was another reason for redesign. When our first site was created, or the most recent one, a great deal of the copy was boilerplate department and treatment info from other sites. The content was not customized to us, and on occasion even included information on procedures and equipment we didn't really use. So our folks at Kinetic worked with each department to rewrite the page information for accuracy and clarity. A side benefit of this, and I'll talk about this a little bit later in our tips, was a closer relationship between our department and between those departments and our marketing department. In some cases, there had been rarely any direct contact or interest in promoting their procedures that they do. So the website redesign project helped to increase the hospital's overall visibility. So like I said, the site went live in February of 2020. So COVID has impacted all of our stats in good ways and bad. Some of our big events were postponed, as I'm sure many of yours were. Our annual Fantasy of Trees event is the absolute highlight of the holiday season in Knoxville, and we were unfortunately forced to cancel it in 2020. It was doubly unfortunate for our website traffic because annually during the months of November and December, the Fantasy of Trees typically generates about 14% of our annual site traffic. With info on the event, the activities, presenters, and entertainment, etc. This year, the new website helped manage multiple online events that were held instead. And while we didn't quite meet the numbers that we have in the past, they helped us maintain a level that was comparable. So if you can see from our stats from Q4, there was a 157% increase in sessions to the services area, which was primarily due to organic search traffic nearly doubling. And finally, my tips for a successful redesign. Number one, shore up your communication with every department. If you're at the beginning of the process of converting, make sure you shore up your communication by finding the right people to talk to. Who has that information? Do it early so you're ready. We were lucky. Everyone was on board, even our C-suite. And it was a couple of people in marketing helped me gather the content. And because the scope of our system is relatively small compared to other multi-hospital systems, it wasn't quite as challenging, but as we discover, every nook and cranny of the hospital needs to be represented, so it was still a challenge. Second, the system, find an easy to use platform, and VitalSite and Kinetic certainly is there. And it was something I was very comfortable with. Also, attend the webinars like this one every month to get information on digital healthcare marketing. And finally, design to your audience, and don't be afraid to bring your culture into your design. Nobody wants a corporate site. Take some time and creativity, experiment, and show off what makes your culture special. That was the driving force behind our art project, is that we wanted to be able to show that we're a children's hospital and we meet the needs of children all across the board, and our art projects did that.
Fantastic. Thank you, Barry. And our final presenter is Terry Skitch from PIH Health.
Thanks, Ben. Hi, everybody. So PIH Health began as a small nonprofit hospital in the 50s. One of these little buildings in the middle was the original hospital, and then all of those outlying buildings are our current Whittier campus. Today, we're still nonprofit, but we're a larger healthcare network. We have 3 hospitals. We have home health, a hospice care. We have a large medical group with 95 clinics, and our service area covers over 3.5 million people in Los Angeles and the surrounding areas. The vision for PIH Health is patients first, and no matter how large we grow, it's a huge part of our culture, and it's always patients first. And so what triggered our redesign? We originally launched pihhealth.org with Geometric in 2014. So just the age of the website made it stale. The more that design preferences and industry standards evolved, the more outdated our website became. Our brand identity never changed, but our use of secondary and tertiary colors, different design elements on our branded materials had changed over the years. So our website just got further and further behind in the look and feel. We had also experienced great growth in our organization during that time. So it was necessary to design a website that could handle continued growth. And the goals of our new site, there were many, but 3 of them. One of them was to unify all of our PIH Health entities under one brand identity and website. Some of our acquisitions had their own websites, so it was important for us to provide a welcoming place for those patients to find the information that they were accustomed to looking for. And also to provide easy access to the information for our existing patients. Some of our old content was very difficult to find on the site, so it's much better after the redesign. And then finally, to build for growth, we needed to overhaul our content and location strategies to allow for the acquisition of future hospitals and medical groups. So we attempted to design it, whether we acquire 1 or 12, we wanted that flexibility and scalability to do so. So here's our new site, also built on the CMS, VitalSite CMS, which we used on our previous site. And it's like Alex said, it's very easy to use. Our site is also responsive. You see all the elements here. It just launched about a month ago, and the feedback from my internal audience is excellent, much better than I expected. My favorite comment was, in all caps, "Our website rocks." And the reason it's my favorite is because it tells me that our executive committee, they own the website. It's not my website or marketing's website, it's their website, and they love it. I didn't get one negative comment, everything was positive. And some of the design elements that we've had fun implementing were the strong call to action that you'll see if you look at the laptop version here. The call to action is the blue box at the top left side of each page. And we did not have strong calls to action in our previous design, and so this has been wonderful for us. And also we've been using the call outs that help draw attention to important content within the body of the page, not necessarily a call to action, just a design element to help important information stand out. And so with the help of Geometric's content team, we developed a content and location strategy that work together that allow us that ability to grow. So our health services content was written at an organizational level so that we could show the breadth of our services. So if one of our patients needs a procedure that's not performed at their usual clinic or the closest hospital, we will perform that procedure at another location. And then each location was designed so that we could highlight the items that were specific to that location. So we list the top services offered, dining, parking, hours, visitor guidelines. And that way, like I said, if we have 12 hospitals one day, each of them will have their own specific information. And then geolocation is something new for us with this site. And it's great for patients so that they can quickly see which doctor's or urgent care location is closest to them. And also the dynamic content is driven by the location as long as the visitor accepts the geolocation access. And we enhanced our custom provider profiles in a couple different ways. We did reduce the number of ratings and reviews that show at the bottom of the page. In the previous site, they scrolled on endlessly and the page just never ended. So now we show, I think, 5 and then a button to view more. And more importantly, we moved the placement of the provider's personal bio so that it's scalable. So now that we can highlight subspecialties or particular procedures that a doctor performs, we can really tell a story about each doctor. And the previous design, that bio area was very limited and didn't allow us to do that. Next slide, please. So the change that I hear the most positive feedback about is this page. It's the health services landing page. And we converted the standard A through Z horizontal list to a style that displays the health service name under each respective alphabetic letter. The feedback from users is that it just made it so much easier to find the services that you're looking for. And with such a minor change, it was really not difficult to make this change. It made a huge impact on our audience. So some specifics on content. Our site architecture was overhauled for usability and SEO. So some of our services, we actually broke out into 2 separate services. For example, we split women's health into 2 categories, gynecology and then pregnancy and birth. We cross-link to each other because they are related, but each of those terms had higher search volumes than women's health did. So we separated them out. And we did that for quite a few other things, just based on SEO. What are people looking for? How can we help them find it easier? How can we get those Google results up? And then the content was written for the web in easily scannable and digestible sections. We use a lot of headers, bullet points to help the reader quickly find the information they're looking for. And Geometric does help you write for the web for that. And then, as mentioned in a previous slide, the content was written to represent the organization as a whole. Our previous content was heavily skewed toward the original hospital in Whittier, and it was beyond time for a refresh. And then I want to call a special attention to unique design feature. I think it was Alex that mentioned the smart panel that you can display related physicians and locations. Well, we use this new design at the bottom of the health services page. And so in this new design, the user can scroll through to several providers before they click to either view all or click directly on one of the providers. And we control how many to display. This particular service, you don't see the view more button because we only have 5 providers for this service. So if they were to click that arrow, they would see the 5th one. But if you have 12 providers, you would see a button that says view all. And some hot off the press 30-day stats. Our page view sessions and users all increased. Our bounce rate decreased by 13%. And then our sessions from Los Angeles increased 117% over this time last year. So again, we're looking forward to see how these numbers change, but for now, they're looking good. And then my tips for selling a redesign. A redesign requires commitment of both time and budget. My suggestion to helping you get that commitment is actually a 2-step process. So first, you should use SurveyMonkey or some other similar tool to survey your executive team. Ask them how important is a strong web presence for them, and then also in their opinion, what makes a good healthcare website. Then go out on your own and compare your website to your local competitors and note the weaknesses. Grab screenshots so that you can highlight those weaknesses. Oftentimes, the weaknesses are look and feel, just because that's human nature, but do your best to match your competitive analysis to the survey results that have come in on what your executives consider a good healthcare website. And then finally, present your survey findings along with your competitive analysis, and you might just find yourself with some budget dollars, and hopefully you do. And so that's it, and I wish you the best of luck on your future redesign.
Thank you, Terry, and to all of our presenters for today. We're actually going to turn our cameras on for the Q&A, so you can see our smiling faces. And we do have a couple of questions, but if you haven't entered your questions in the little Q&A panel from WebEx, go ahead and do that now. We should have time for a few questions yet today. There's a question that came in a little earlier, and you touched on this just a bit, Terry, but doing surveys to leadership and stakeholders, other stakeholders, before your redesign, What kinds of things are you asking in those surveys? What are you looking for there?
Well, you want to make it very simple. You want to ask a very straightforward question. I would say the first one is, how important is a good website for your business? Is it high, medium, and low? I'd make it that simple. Rate the importance. And then another idea is to have them order in the order of importance. Ask them what brings more patients in your opinion. What brings more patients to us? Is it billboards? Is it newspaper ads? Is it a website? Is it social media? Is it email campaigns? And let them rate the order of importance. And I guarantee you, website's going to be very high. So those combinations of how important is it to you, plus, what methods do you think makes good marketing? And I think you can start that with your survey.
Fantastic. Any other thoughts, Barry or Alex, on surveying stakeholders at the outset of the process?
Well, I mentioned before that it was so important for us to establish or reestablish relationships from our department in general, and myself in particular, since I was fairly new to the hospital, and get to know them and get to know what their departments did. Coming into pediatrics, everything's just a little bit different with pediatrics, and understanding how they deal with subjects that I'm familiar with, like cardiology and oncology and things like that, how it's a little bit different for kids, was important for me to just to understand what was going on in the hospital and how the hospital works. So I think it's a big thing that everyone can do. That's important for everyone to do, is just to reconnect with everyone, and it helps them too. It helps them understand a little bit more how to explain what they do and how to get the word out in regular marketing techniques. We're always looking for people to do video interviews and media interviews. So just really reestablishing or establishing in the first place those kind of connections with your hospital, I think is really important.
Wonderful. We've got a question here looking at how you manage highly opinionated senior leadership, maybe, but certainly physicians, folks who may not be marketing or digital marketing experts, but may have nonetheless very strong opinions on how the website should be structured, or the type of writing, or text heaviness of a site, things of that nature. How do you work with some of those strong-willed individuals who may have a lot of political power within the organization?
I can take this one. So what we find, and I'm sure Terry and Barry, you find this too, everyone's an expert in marketing. Everyone knows what they're doing. So for us, being in this job field, we're kind of used to it. It's kind of an everyday thing for us. So when it came to the website, I will say personally for us, we were very fortunate that everyone was very supportive and listened to what we had to say. However, that being said, we have had times where maybe there's some strong-willed people we're working with. And I think the best thing to do is just to take what they're saying, take your notes, write it down, and try to incorporate some small features. So maybe they want a lot of information, try to scale it down, maybe use accordions, maybe do some other kind of design feature. But really, when it comes down to it, we're the ones that are the experts, and we're the ones that have been listening to the public and doing the surveys, and we know what's going to be best. So I think if you can just kind of maybe de-escalate some of those conversations first, but also include those people in your stakeholder survey so they feel like they have a voice. I think sometimes it comes from a place that they feel like they're not being listened to. So sometimes all it takes is for somebody to sit down with them, and then they feel better about it.
Yeah, I can attest to that. We invited particular people that we knew would be those people into a committee to get them involved, because if you're involved, you own it, and you want to carry that out. So that's how we got them on our side of doing what we wanted to do. And another thing is we we have access to market insights surveys. So we take, and these surveys are not our patients, they're within a 10-mile radius, and then there are other ways we can get nationwide information. So we take actual confirmed data and show them that data. But like you said, you have to respect them. You have to listen to them. You have to hear what they have to say. Lots of times they have good ideas that you do and you should incorporate. And then you work with them back with the survey information that you have that's accepted and nationally recognized. And so you work it through and you negotiate.
And I think coming from our perspective, making sure that the physicians are comfortable in a collaborative environment is important. Obviously, physicians work together, they work with their staffs, but I think sometimes working with a marketing staff or working with an IT staff, that kind of thing, may be a little bit different to them. And making it as comfortable as possible for getting information is really important, and making them, as part of the team just as much as we are, and we're all working together. And our biggest priority, our main priority, is to make sure that the parents of the patients and the patients themselves are understanding what they need to understand and be comfortable with it. So we can all work together to find the right language, to find the right way to say something. And I think just making everyone an equal member of the process helps, and not trying to make a hierarchy too much.
Fantastic. We actually have a question on how people can get their hands on that design portfolio. So as we talk, since people can see our actual faces, I'll go ahead and put this up on the screen. People can go to that URL to download. And again, I believe there's also just a checkbox in the post-webinar survey. Couple of more questions have come in. What process did you use to pick a platform or company to work with for your redesign?
Do you want me to take that?
Sure.
Now, this time I didn't go through that process because I was a previous Geometric client, but back in 2013, 2012, when I started my homework, I created a graph and I outlined what were the important elements to me. And then in looking at industry information, I found different website vendors and partners. And I also wanted, when I started, I didn't want a healthcare provider or a healthcare specific website company to help us. I wanted somebody from the outside. And then as I talked to more of them, I ended up with Geometric, which is healthcare related. But I made a chart, and I quantified what was important. And so I outlined my questions first. I gave them a rating scale. And we rated them, and like I said, we had a committee, we had a steering committee, a very large steering committee. So we took those ratings along with screenshots and different presentations that each company had given us. And so we literally ranked the people that we were evaluating. We gave them a numerical score, and price, cost was one of those. But we went through and we scored, and the committee agreed. Now, we did make a recommendation to the committee of what we wanted, but the committee drove it, and they listened to our recommendation, and that's how we did it. So we gave them a scorecard.
And we actually got a related question. If you have any tips about breaking up with your old web vendor.
Well, for us, that was easy because I was able to go the route of we're going with someone who's healthcare focused. So they understood, because a lot of the requests we had been making, they just couldn't do for us. So that's how we were able to get through with that.
Well, we were just honest. We included our existing vendor in our analysis and our RFP, and we scored them all, and we were really honest and said, here's where you came in on the score, and here's why, and here's what we evaluated, and we just told them the truth.
We just told them it wasn't you, it was me. So.
And how did that work?
We're still waiting to hear back.
Okay. We have time for one final question. Now that you've had these great successes in completing and launching your redesigns, what are the top 3 next things you want to do to add sparkle and amazingness to your websites?
I'll take this one to start with. We're planning on adding more illustrations. We have many more art projects scattered around the hospital, and they have been very successful, and we've gotten great feedback from the ones we have. So we're going to expand. We're going to add more, and it's so important for us to be. Again, I said before this, we called it the whims. I called it the Whimsy Project, and that's what we are. A children's hospital has to be friendly and inviting, and a place where kids don't have to be afraid to come to, and using those art exhibits are a big part of that, and we want to put that on our website so it reflects what the parents and the children will see and experience when they come to the hospital. So that's one of our big priorities, is to get some more of those.
For us, oh no, go ahead, Terry, go ahead.
We use a lot of provider. Oh, there goes our siren. Let me mute myself. You can go ahead, Alex.
Okay. For us, as I mentioned earlier, phase 2 is kind of that adding that payment module to our calendar of events and other items. But another thing we want to tackle is the pictures on our location page. So where we have some of our provider practices, right now it just has kind of a generic picture, but we really want to go take good quality pictures of those locations. So that way if somebody's looking at it on a map before they go and they get there, they're like, oh yeah, I'm in the right spot. So that's another big thing for us that we're going to be tackling soon as well.
Yeah, we just had a planning meeting for that just yesterday. So our location images are not the best, and so that is on our list to do. But what I was going to say is we do use a lot of video to promote our providers. So we are scheduling in a couple of weeks to do more videos, and we drive traffic there. And then we're going through a huge conversion of our credentialing system, so that will allow us better marketability. We'll be able to drive to landing pages for find a PCP, and they'll actually have PCPs there. You know, today I can't specify a PCP from not. So the credentialing system conversion is going to be marvelous for marketing efforts. It won't be sparkly and shiny, but it will be for my team.
And another thing that we're doing as well is we're trying to establish some more interactivity and some more utility for our site, adding in some of the things that were mentioned in that survey, such as provider ratings and provider reviews to our site. We're looking into how that will work. So that's really important. And as well as we're integrating more telecommunications into our complete practice plans, and we're going to help incorporate those as well.
Fantastic. There were a few questions we didn't get to, and we'll follow up with you individually on some of those as appropriate. To our 3 presenters, thank you so much for sharing your stories, some wonderful information. For those of you who have stuck with us to the very end here, again, we've got this wonderful design portfolio, and just like any overhaul project, inspiration is a great place to start as you're thinking about these things. In addition, just a reminder that next month we're going to have this fantastic webinar about web writing in a post-pandemic world. Really looking forward to that. Again, you can sign up for that at geonetric.com/webinars. So thank you for joining us, and have a wonderful rest of your week.
Thank you.
Thank you. Bye-bye.
Bye.